Good morning, everybody. Welcome back to Visage Clinic here in beautiful Toronto, Canada with aesthetic plastic surgeon Dr. Marc DuPéré. And I want today to discuss this very important entity, lipedema, which is still a bit of a mystery in North America, but something that affects thousands of Canadian ladies mostly. It's also something that's well known, described in Switzerland and Germany, in England. They're about to find the genetic components to this. There's no doubt that there's a familial connections with lipedema. I see my patients coming, they have a history with mom, grandma, aunts, sisters, so it's very common. So lipedema is a disproportionate amount of bumpy fat, lumpy fat in the lower extremity. There are usually very narrow-waisted, narrow torso, but again, large lower legs, commonly involving the lower legs all the way to the ankles, where they lose the ankle definition. Some people call this cankles. Now, you can imagine they cannot easily wear boots. They cannot also easily find clothes because they're large here and they're narrow here. So it's always an issue for our patients. They're also self-conscious of the lack of definition. So wearing Bermudas, shorts, skirts usually are an issue for our patients. Lipedema has been done here. I worked on the lower leg already. You can see the marked difference between the two. I've removed already 2,000 milliliters on her left calf, on the back only. I will remove a little bit more on the front. I've given her back some ankle definition, which she will be very, very happy with. This little pocket, which I've done here already, is classic of lipedema behind the knee, and then she has 3 or 4 of those little pockets in front of the knee. Again, classic of lipedema. I use Tumescent Solution. Tumescent Solution is used for many reasons, one of which is to tumesce or to swell the soft tissues, which makes it harder for us to hit and damage blood vessels and lymphatics. We call it lymph-sparing type of liposuction. I tell people when it's swollen and tumesced, it's harder to hit a blood vessel or a nerve like you would try to poke a spaghetti with a fork. The spaghetti will push away. The tumescent also has adrenaline or epinephrine, which is a vasoconstrictor. It allows us to do more liposuction with less bleeding. If you see here in our first 2,000 cc's or milliliters, you have a few red blood cells, but it's mostly yellow fat that's been removed. And this is despite using an anticoagulant on our patient because it's a longish procedure. This lower leg is a tricky area. That's why most plastic surgeons don't like to work on this, because there's only one layer of fat. It's a little bit more prone to tracts and surface irregularities. So I take my time. I do a 3 millimeter, sometimes 4 millimeter cannula. I will use some of the 2 millimeter as well, so very fine and small, and we take our time. I will also do a serious equalization, which is part of the concept of safe liposuction. So suction, aspiration, fat equalization, so safe liposuction. I will do that in a few minutes to make sure that we have a smooth contour. I will continue on the thigh a little bit, then we're going to turn her and we'll complete the 5-liter liposuction as a safe amount in Canadian clinics when patients are discharged on the same day. Lipedema surgery has been something I've been performing for 20 years in Toronto, and lots of happy customers. So I'm very happy to be able to help my patients with lipedema. And for those interested, there are groups on Facebook discussing this condition, and I invite you to follow them and also to watch our YouTube channel. Thank you for watching. Have a lovely day.